Dr. Craig Koniver.
Hey,
How are
Aubrey.
you, my
I'm
friend?
good, Aubrey. Thanks for having me.
Yeah, it's a pleasure to have you on. So, to me, you represent the future of where medicine is going.
Oh, well, thank
And
you.
this is like someone who has their full MD
Yep.
and the repertoire of all the, quite frankly, amazing drugs
Sure.
that are available in the pharmaceutical pharmacopoeia.
Yep.
But has the wherewithal and the intelligence and the knowledge about diet and nutrition and vitamins and supplementations and alternative therapies and plant medicines and all the other things that you can do
Right.
so that you don't have to rely on those pills that go shaky, shake, shake
Yeah.
in those orange bottles.
Yes. Yeah. You know what? I went to medical school and I met this doctor. One of the first talks we had, this famous pediatrician in Philadelphia. He said, your job as a doctor is to recognize and learn who is sick and who is well. And I think the interesting thing about medicine these days is that most people are sick. They're not truly sick in the sense that, oh, they're in the hospital, but they just don't get it, and
Yeah.
the doctors are pumping them full of, oh, you have depression, we need this antidepressant. Oh, if that doesn't work, let's add 2 more. Oh, if that doesn't work, we'll add 3 more. And it's like medicine has stopped thinking.
Well, take us through this because,
Yeah.
a lot of things, I think we have some perceptions on how doctors really work and how
Yeah.
it operates and how the drug reps might influence.
Sure.
Like take us through the traditional medical model.
Sure.
Like what is it
That's a
really
good
like
question.
from the inside?
Yeah, it's all pharmaceutical based. So
Yeah.
medical school is dominated by the mantra of patient comes in with a complaint, the doctor is trained what medicine or which medicines I need to prescribe. And that's where it starts and that's where it ends.
Mhm.
And there's such history in that, which is weird because if you think about it, we've only been using pharmaceuticals for 100 years at most.
Yeah.
100 years. So, medical school, the first 2 years are hard sciences. So you're learning anatomy, biochemistry, physiology. The second 2 years, it's all about the medicine. How do you take a symptom, a patient comes in, and give them a medicine? And if that medicine doesn't work, like I said, give them 3 more. And doctors have stopped thinking. And I don't fault doctors for, people ask me a lot, why doesn't my doctor think outside the box? He just hasn't been trained. He's been totally dominated by the pharmaceutical industry.
Yeah.
Completely dominated.
What's really interesting, I highlight this in my book and I don't have the statistics right on front of me in the top of my head, but there's a great majority of conditions that are stress related.
Yeah.
Right. And even doctors are willing to acknowledge that
Yes.
a great majority of conditions are stress related that they encounter. But very, very few give any counseling or any advice on any stress management techniques.
Sure.
And when they're polled and the actual results are in, it's because most of them don't even feel equipped to talk to them about any stress management techniques. It's like, so, okay, you have something that you're aware of is a primary symptom driver, stress. And doctors are even aware of that. And nonetheless, they're not going on their own and figuring out ways to handle and mitigate stress because they're probably not even doing it in their own life.
They're not.
And it's just an interesting paradigm in which we identify a problem, but we're still relying on these solutions that are proving to be, in many cases, with the side effects and the quality of life that's being caused by some of these prescriptions, we're not making the shift.
No, and the interesting thing, if you look at negative drug studies, so these are studies the pharmaceutical industry or the pharmaceutical company does to see does the drug work or not. Negative drug studies show no, it didn't work, or it led to side effects we didn't want it. Those are not published. And so when there's a doctor, he did a TED talk years ago, and he looked at negative drug studies compared to positive drug studies for antidepressants. And what he found was it's literally a coin toss whether an antidepressant will work for someone. There is equal data that it won't and that it will. And that's terrible.
One of the doctors who's opening a ketamine clinic, Dr. Sanj, who's a psychiatrist who's out here, was talking about even the way that even the arc of depression as when it's been being treated by a pharmaceutical antidepressant, saying that, all right, it's showing maybe some short-term benefit in that first window, but it actually increases likelihood of like long-term depression.
Absolutely.
Whereas depression left on its own will kind of work its way through in its own cycle.
Right.
This extends that and mitigates these initial symptoms, but extends that to more of a lifelong, kind of condition. But we're not looking at these. We're not looking at the right shit, at the right markers.
We're not.
And that's why like the ketamine clinics are now popping up,
Right.
providing actual access to something that can shift the mind state in a significant way. And then, I think we're both looking forward to that 2021 when the MDMA clinics will
Right.
come out and that data, and shifting all that. And then then layer in the psilocybin that's going to come online. And then now doctors are going to have, all right, all the tools, all the little pills that go shaky shake, little stop gaps, little temporary ways to stop the flood and things you need a little help with. And for sure, we're not saying throw all that out, but now have really powerful tools to drive cures, not symptom management.
Yeah, but see, that goes against the whole medical model, right? We don't want to cure things. It's so driven by the pharmaceutical industry.
You want to cure things?
Yeah. Well, we were talking earlier before we started. I had a patient, this was probably 10 years ago, and she was in her 70s, diagnosed with cancer. I don't remember what it was. And she went to an oncologist, started on chemo. And I saw her back for follow-up like 6 months later with her grandson. She was in a wheelchair. You could see she had totally declined. I said, well, what's the deal? What's happened? He said, the oncologist says the chemotherapy is not working. Okay, so what's next? What's the game plan? More chemotherapy. And it's like, okay, that's where we are. But, you talk about cortisol. What I find fascinating and where I think doctors fail is because they stop thinking. Like we can literally measure these markers like you're talking about in terms of cortisol levels and how we modulate that in the brain and the body to lead to effective change for people so that you can actually help bridge them to a better place.
100%. And not only, testing and all these things, even breath work, even like, 6 deep breaths in a Japanese study was shown to lower blood pressure.
Yeah.
Right. Like you go to the doctor and you have high blood pressure. Do they even mention breathing?
Of course not.
But the study's there, the data's there.
Right.
It's just, that's not anything that has a price tag.
But also we are so driven by this, pharmaceutical model. Everything's got to be studied and tested, right? Like we're so data driven. But if you look at all of these modalities in health, we weren't relying on, does ashwagandha work? We know it works because people have been using it for thousands of years. Licorice root was found in Egyptian tombs from 3,000 years ago, right? Yeah. Why is that? Well, they're not taking licorice root because of the taste and taking it to the afterlife. They're taking it for
they are. Maybe they are, Craig. You don't know. Have you been to the afterlife?
Well,
do you know? Have you met Anubis? No, you don't know.
but what I'm saying is they're probably taking it for the healing properties of 100%. That herb, right? And so to ignore that and say, oh, well, it hasn't been studied. We haven't put it up to a test versus Prozac, so it doesn't really work.
Even when we have, there's really good studies on comparisons between 5-HTP and antidepressants and valerian and anti-anxiety meds and showing comparative results in double-blind clinically tested studies. Yeah. But still, those are just kind of largely ignored. Even though 5-HTP, when you look at the side effects of 5-HTP, you're looking at a whole lot of nothing.
That's
and then you're looking at antidepressant side effects, and you're looking at
laundry list.
Homicidality, suicidality,
erectile
dysfunction. Well, maybe you try one first, like do the least harm with potentially the same amount of benefit. Yeah. And it's just a really weird time that I think we'll look back, because you look back in the old days and you look back at leaching people from their blood and you look at lobotomies where they would stick an ice pick in the corner of somebody's eye and like electroshock therapy. And you're like, wow, we were barbarians then. And I think we're going to look at clubbing people with these pills over and over again in the same barbaric way, spiritual barbarism rather than physical barbarism, that we look back at those things now.
Yeah. Yeah. No, I totally agree. It's getting out of control, but I think the good news is I think people are waking up to this. I think people as a whole, our society is saying, I don't want to be on 4 medicines. I'm tired, I'm overweight, I'm depressed, but that's become the norm. Like if you look statistically, greater than 50% of Americans are overweight, tired, depressed, and taking at least one pharmaceutical. Like that, how is that working? It's not working. But I think the good news is people are starting to wake up and saying, there's got to be something different, right?
Yeah, and there is. And that's the good news, is that we're not in a hopeless condition. There's lots of different things that work and lots of different ways that we can kind of look at all the major systems.
Right.
I want to circle back. You mentioned cancer. Are you familiar with Travis Christofferson's work, The Metabolic Theory of Cancer?
Somewhat, yeah.
Yeah. The evidence for a restricted ketogenic diet, hyperbaric oxygen in the treatment and mitigation of cancer I mean, there's pretty significant data coming out just from dietary change and, the utilization of oxygen to rehabilitate the mitochondrial cells.
Sure.
Which are, one of the big fail points when you're talking about most of the different cancers.
And not just if you're talking about mitochondria, you're talking about pretty much every big back diagnosis now, from dementia, cancer, diabetes, heart disease. That's where the research is going.
So whatever the condition, I think that first step, like, all right, let's try the RKD, try to switch your body over to ketogenic and see if you can support your mitochondria in an intelligent way. Like what is, if you're going to start layering on, all right, from the ketogenic diet, hyperbaric oxygen, what are some of the other ways that people can support mitochondria in general that you kind of look for?
Yeah, I think the ketogenic diet is foundational, right? So you're supplying fats for fuel, you're making your mitochondria more efficient. I think certain nutrients stand out, like coenzyme Q10, the B vitamins that people fail to get.
What do you think about the ubiquinol?
Yeah, I'm never bought into like ubiquinol versus ubiquinone. I think, CoQ10, people unfortunately don't have the time to understand all those differences, right? Like, I think it's just easier to take CoQ10 and go with that.
Get it in.
Yeah, get CoQ10 in.
Kind of like how Wim Hof talks about breath. Doesn't matter which hole, just get it in.
Right. But I think the most exciting, the most profound way to alter the dynamics of the mitochondria is the NAD plus, the nicotinamide adenine dinucleotide, the B3 vitamin derivative. There's so much data now. So NAD is the rate limiting substrate for which our mitochondria makes ATP. And the cool part is that when we give people NAD, and this is where all of anti-aging is going to, is when we give people NAD, we increase the NAD to NADH ratio. That stimulates mitochondrial fission, which increases mitophagy, or getting rid of defective mitochondrial DNA. So you're basically cleaning house. Now the tough part is, I was just reading this the other day, is the two cells with the highest concentration of mitochondria are the neurons, the nerve cells, and the heart cells. And it's estimated that one neuron has 20 million mitochondria. One neuron.
Wow.
And to keep up with those mitochondria, we have to make 30 to 40,000 new mitochondria every single day. So if you put it in that perspective, like, this is a big challenge for us, right?
Yeah, this is a battle of energy.
It's all energy, right?
This is all when the body, and I think that's one thing we forget to realize. Like, the body is an energetic machine.
Yes.
And when it runs low on energy, it doesn't have the fucking fight in it.
Nothing left.
There's nothing left. It can't beat the cancer cells as they grow. It can't beat degeneration. It can't beat. So supporting our cellular energy system at a core level is
paramount. And so this is what I'm excited about, is not just NAD. There's other things, caloric restriction, intermittent fasting, ketogenic diet. They're all, cold therapy. They're all striving to do the same thing to the mitochondria: increase mitochondrial fission, get rid of the bad mitochondrial DNA, which then stimulates mitochondrial fusion, which is making, bigger, better, more efficient mitochondria.
Yeah.
Relating that to you're in the fitness industry. What's interesting is, if you get someone to mitochondrial fission, they will then make less ATP, and then you have them go do a intense workout. Well, now their muscle has to work harder in an environment with less ATP, so it has to work harder. So you'll actually become more efficient at building muscle when you're in mitochondrial fission. And so that whole, you can take this so many different directions. And that's what's so exciting about the mitochondria.
Training is another way to support your mitochondria as well.
Absolutely.
That's something I talk about in my recent book as well. Like, exercise is a fucking miracle drug.
Yeah.
It is a fucking miracle drug. Like, what do you want to treat? What do you want to treat, everybody? Hey, everybody, you want to treat something? Hey, guess what? Exercise is going to help.
And it doesn't matter what exercise.
Really, you just got to move. Matter. You don't have to go to a fancy ass gym like we have here on it. You just got to move.
You don't have to lift heavy weights. That's right.
No.
You just have to move.
Go fucking swimming. Go run around. Go play. Go do something. Take the minimum effective dose of the miracle drugs that we have available.
Well, I tell people, what did people do thousands of years ago? The vast majority of their exercise was just walking, right? Every now and then they ran hard at something or from something. And every now and then they had to lift a heavy object.
Yeah.
But the vast majority was walking. We don't even do that anymore. And that is foundational.
Yeah. It gets really it's like we're skipping ahead to these very dangerous, stopgap implements, like these pills, when we're not even doing just the very base level of the pyramid. Like if we were going to, like they had that old bullshit food pyramid. If you have the actual true health pyramid, you're talking like, all right, well, how about some sleep and some exercise and some sex and some sunlight and some water.
Right.
And then let's start there first. Okay. And then maybe some stress management, some mindfulness, some breathing, learn how to breathe right.
Right.
Let's do that. And okay. And then let's layer in the nutrition. All right. So let's stop this fucking mad carbohydrate, sugar, metabolic ping pong that's wearing ourselves out.
Right.
It's just like the way to think about that kind of metabolic ping pong when you're taking in all of these carbohydrates and all these sugars is think about your body. It's like you're folding, increasing it over and over again. Every time you make that swing, you're just wearing yourself out.
Sure.
You're like completely wearing yourself down.
But you asked initially, like, what's up with the medical model? And at its core, it's fear, right? And you talk a lot about fear. And I think that is the fundamental issue. Doctors, the healthcare system promotes fear, right? So we teach people to be afraid, and we do not promote abundance and love and nurturing. And I think that's where it starts.
That's very true, because there's always something. I mean, you Google something and what you get back is terrifying.
Scary. I have a rash in my hands. This means I could have this rare cancer. I mean, it's possible. I mean, I hear that all the time from patients. Like, I Googled this. This is what's going on. Do you think this is going on? I just did a survey of my patients just a couple of weeks ago asking, what are your fears? What are your goals? Number one was people are afraid of cancer. I mean, it's fear.
That's where, like, reading that book, The Metabolic Theory of Cancer, was so reassuring for me. It completely shifted, because I've had a few people in my family die of lymphoma. And so, when my glands get swollen and I'm fighting something off, there's that little fear response, like, uh-oh, don't want to be like Uncle Craig or, like my grandpa or, something like that. But then reading the book, I was like, all right, if I do, then that means we're going RKD, I'm going hyperbaric. They talk about some other experimental drugs focused on mitochondrial rehabilitation.
Sure.
And I'm like, all right, we'll beat that fucker.
But even beyond that, like if you were diagnosed with cancer, what you would do, I'm sure, because you get it, is you would reevaluate your life as a whole, right? Like that's what a cancer diagnosis is. It's a wake-up call. And I think it means people have gotten to that point based upon fear, right? There's something underlying, whether it's relationship stuff, job stuff, things from their childhood, that has been so ingrained in them that they're so far away from their authentic self that they are just not in touch. And so I think they've shown there's only one thing that's been shown to be helpful in every type of cancer, and it's positivity.
That's a really interesting thing too, because that's been shown, and that's why we test for the placebo in every single clinical trial.
Right.
That's why the nocebo does harm, and it's why the placebo does well. That ability to use the mind to send those signals, to upregulate the receptors for those positive endogenous chemicals and down-regulate the receptors for the negative ones, decrease cortisol, allow your immune system to function right, tell your body that, hey, body, it's going to be all right, man.
Yeah, everything's going to be, I mean, worst case scenario, you die, and that's where it gets good, right? That's the celebration. So if we started teaching that and preaching that to people, that's game changing of itself. Like people are so afraid of dying they're afraid to be healthy.
That's fucking deep, my friend.
Yeah, but it's true.
It's almost, getting over your fear is dying to that fear. And it's this idea of like dying to live. I actually just released a poem today, and because I was pondering this. I was like, what is our purpose? And our purpose here is to love and die. And I was like, but the way to do that is to die first and then spend the rest of your life loving. Like, die to your fears, die to your expectations and your identity, die to your name, die to all of these things that we're defending and are causing all this fear. And in a way, surrender so that we can become who we really are, which is life expressing itself physically, which is love expressing itself physically.
Right. But what you just said, that'll never, ever be talked about with a doctor or in any sort of medical education, right? And then we promote doctors as the kind of purveyors of health. Well, they're not anymore. They're just not. Medicine's not about health, right? Medicine's about fear of disease. It's totally different. And so the way I look at it, because I see the world from a more of a biochemical lens, is, well, one of the ways to build each of us up to be, stronger and have a better mindset is to literally build us up with nutrients and exercise, all these things that are just positive, that you're just, making your body, your mindset stronger, so that then you can enter into any sort of situation in a positive, mindset framework.
Yeah.
But we'll never get there in medicine.
What do you think? I mean, it's not that the doctors are bad people. They've
Not at all.
probably they've been awash in their own fear system.
Absolutely.
For so long.
Yeah.
That they're probably abiding by the same thing. I mean, doctors are going to other doctors.
Right.
You know what I mean? It's not like these doctors are like, oh, I'm going to give the people some of this bullshit, but I'm going to go see my spiritual guru for my own health. Fuck no. They're going to their other specialists, and their specialists are going to the other specialists, and it's this self-reinforcing system.
Yeah. Yeah. And so that's why medicine's not how we'll ever make change. Medicine is, and like you said in the beginning, we got some awesome drugs, right?
Mm-hmm.
But those drugs are really for critical things, and, what I like to think about how I help people is I have more tools in my toolbox than most doctors, right? Like I just do. Like I've been in the intensive care unit and had to help people who are literally dying. Yeah, that requires some high-tech drugs. But if I really want to get someone well, then it's all about mindset, and it's all about nutrition and exercise. It all comes down to that.
Mm-hmm.
So,
and what have you done to help educate yourself in that? I mean, obviously you're the type of person that's walked your own walk.
Yeah.
And done the things to help your own self. I mean, is that where a lot of this came from? And is it a blend of that and then reading journals? I mean, where do you keep up with these different practices?
Hard. Yeah, it's hard. I think, some of it started when my daughter was born in 2001. She had colic. So she could never get comfortable. We had to hold her 24 hours a day. She was uncomfortable. Took her to the pediatrician, and the pediatrician was like, she'll grow out of it. Give it 3 or 4 months. You would never say that to an adult who's crying all day long. And that was a big red flag for me. Like, what do you mean just let her get over it? She's bawling, crying. So that forced me to say, I've been always natural minded, but I got to go outside the box here. Like, this isn't working. This can't work. And once I got outside that box and I realized, the people who actually embrace health as a holistic entity, as opposed to just a pharmaceutical, management or a surgical management, are actually much brighter. And I'd much rather align myself with the people who are renegades and like to think than people who just like to write prescriptions. And so for me, it was, most of it is self-taught, is finding those resources of people. And there's not many of them who give out reliable information. And then for me personally, I would read something and I would try it personally. And then I would try it with patients. And I do a lot of experimentation that way. That's the only way, we're ever going to learn something. So if I read about, glycine's great for the nervous system, try it at 1,000 milligrams at bedtime. Well, what if we did 10,000 milligrams, right? Okay, it worked this way. Now I'm going to have 3 patients do it.
Right.
And pushing the envelope, because the majority of this stuff is very safe.
Yeah.
And so a lot of it's just experimentation.
So one of our dear brothers, who's another guy akin to this line of thinking, is Dr. Engel.
Yeah.
And I know that you guys refer back and forth and talk about different things. And I remember I was out spending time with him out in LA, and he was dealing with a viral load. And he's like, oh yeah, Dr. Craig got me on high dose vitamin A therapy.
Yeah.
And I was like, oh, cool. So I sit down and listen to him and rap with him about that. And then there's things that are available that are just people are sleeping on. So what was this vitamin A therapy? Just as a random, example of something that you uncovered.
Yeah. So if you have any sort of upper respiratory infection, common cold, you take high dose vitamin A for about 7 days. First 3 days, it's 300,000 international units. Most people, if they're taking any vitamin A supplement, are getting 10,000, 15,000 a day. So 300,000, that's a shitload of vitamin A. And
that's a medical term, by the way. A shitload is 300,000 I use.
And then you step down to 150,000.
Half a shitload, just to be clear.
And then a quarter shitload at 75,000. And for most people, after 2 days, like, they're totally better.
And there's fat-bound vitamin A, and then there's powdered, right?
Yeah, I think a great source, just to keep it easy for people, is cod liver oil. Is a great source of vitamin A.
It's a shitload. That's a double shitload of cod liver oil.
Yeah, no, it's a lot. It's a lot. but it flat out works. And
Yeah.
so I tell people, do it a few times a year. Don't do it more than that. I mean, theoretically, there's vitamin A toxicity. I don't know if anyone's ever seen that. Same thing with vitamin D toxicity. Oh, you can't get your level above 100. I've had so many people above 100 who had no clue. I think most of it's theoretical. But vitamin A, I think, will play out to be probably a more important vitamin than actually vitamin D. Vitamin D gets all the press. Everyone's like, oh, I'm vitamin D deficient. But vitamin A is like anchors the immune system in a way that vitamin D doesn't. And so that's how I relate to it. Like if you're sick, vitamin A. If you want to build your immune system, like I treat a lot of people with gut disorders, lots of vitamin A.
Okay, so acute respiratory thing.
Yeah.
You want let's just get granular here for a second. Yeah. You want that 300,000 step down, 300,000 for 1 week, step down.
Well, no, 3 days.
3 days.
Yeah, 3 days at 300,000, 2 days at 150,000, 2 more days at 75,000, then done.
Okay, so that's your week. That's your week-long
yes.
protocol. Now, if you just want a maintenance load of vitamin A, what would you say? Just
15 to 20,000.
15 to 20,000. How much cod liver oil is that roughly?
It's going to be probably a tablespoon twice a day.
Okay, so tablespoon of cod liver oil. Is the krill going to have any sufficient load? Mostly in the cod liver.
Cod liver oil is different than like fish oil, krill, things like that. Yeah. Yeah.
Okay, so either cod liver oil or some vitamin A supplementation.
Right.
In general.
Yeah, and you can get it, and there's different, it comes from different sources, whether it's fish liver oil, cod liver oil, and then there's a couple plant sources of vitamin A as well.
Yeah. Speaking of vitamin D, I mean, that is another anchor point. What levels do you like to see for people who are testing their blood for vitamin D levels? What do you like to see?
At least 70, between 70.
High. So you're talking 5 to 10,000 IUs a day.
Most people, it's going to be more than 5. I know 5 gets that's the popular dosage, but the thing about vitamin D is we're utilizing so much of it. I mean, I test people all day long, and it's very hard to maintain an active, efficient vitamin D level. All these nutrients, it's hard. But vitamin D, 70 or higher.
So and I think when people feel that, they're going to start to see a lot of things shift.
Yeah.
From mood to energy to everything else, so, and getting some sun, obviously, when you're talking about vitamin D, it's another thing. Talk about fear. Like we've literally made people afraid to go outside without slathering some fucking toxins on your body.
Well, and the same thing. So, the way I think about it, it takes 12 hours for your melatonin level to reset, right? So if you don't get sunlight until 10 a.m., 11 a.m., your melatonin's not going to kick off till 12 p.m., 1 a.m. Mm-hmm. Well, then you're not going to be tired, right? And that feeds into this whole cortisol circadian rhythm, which now you're not getting quality sleep, right? Because we undervalue sleep. We've gotten so far removed from living with the sun and that kind of natural flow. That's the heart of probably most medical problems, is that people just don't sleep, and well, that's because they don't get sun. I mean, you can trace it all back because they don't go outside. It's all artificial light. They go from their house to their car to their office. Yeah. And it's all tinted. Yeah. No sunlight.
And I think it's one of the reasons why inherently we go to the beach. Yeah. And we go to the beach and God, we feel fucking good.
Yes.
A couple of days at the beach and you just, unless you're just crushing high sugar daiquiris all day,
right,
then probably you don't feel good. But if you actually go, you got your fucking feet in the sand.
Yes.
You're swimming in the ocean. You're getting sunlight.
Right.
You're sleeping good. You're probably, your testosterone is going to be boosted from the sun. Your nitric oxide is going to be boosted from the sun. You're probably having more sex. Yeah. You're probably sleeping better. You're probably moving around in the water, walking on the beach. Yeah.
And then and then tying it back, vitamin A and vitamin D in the brain are used in the cannabinoid system, and that cannabinoid system ties directly to the cortisol system, right? Mm-hmm. And so everything works together. Like you can't separate this stuff.
Yeah.
And I think a lot of it goes back to, the downfall of man is electronics, right? Like we've gotten so far away from the natural living and being aware in our environment that's crushing us. And I'm reading a good book now called Sapiens. I don't know if you've read that. Talking about, we were actually much smarter people when we were hunter-gatherers, right? Because we had this overall sense of nature, space, time that was vastly different than I have a plot of land and it's mine. I own it and you got to work it, know? I mean, and, but that again, all ties back to getting away from living with the sun and this natural flow of things.
So what is, like, talking about the sun, all right, what is the level where someone actually needs to start worrying about skin cancer? Let's just try to set the set the mark here.
I mean, the data says the highest risk for melanoma and probably basal cell and squamous cells before the age of 20. So sun exposure before the age of 20, right? And so it makes sense. We do need to put sunscreen on kids,
babies, and
I mean, their skin is so sensitive. And I do think, as opposed to sunscreen though, why don't we just wear sun protective clothing, hats, long sleeve shirts, and then take breaks? Like get sun, take a break. You don't need to be in the sun for 6 hours straight.
Yeah.
You don't need to be lying out baked.
It's this binge and purge, binge mentality of everything. Like, okay, get all of your sun for the entire year when you're on that fucking 5-day vacation to Florida.
Right.
Yeah.
So, does sun exposure cause skin cancer? Absolutely. There's no denying it. But to your point, we've gone overboard with all the chemicals in the sunscreen. And now people, again, fear, right? I think a lot of it's driven from fear is, oh no, I'm in the sun, I'm going to get skin cancer, right? Well, you start that at age 18, that thought, now you're 38. Oh yeah, you got skin cancer.
People listening to this right now are going to be like, fuck. Because I remember I was like this. I was like, fuck. Like, where do I find a doctor who I can have these conversations with? That's obviously, you're probably going to get a lot of people hitting you up, but like, you don't have, like where do people go? What can we recommend to the listener here who's like, man, I need a resource that I can talk to about this.
There's a good group called ACAM, American College for the Advancement in Medicine. I used to be a member, I'm not anymore. And the doctor members there seem to have like-minded philosophies of thinking outside the box, more of integrative health. The problem, though, to tell you the truth, though, is a lot of doctors are now jumping on the bandwagon when it comes to IVs, hormones, integrative health as a moneymaker. So they're setting up a clinic and saying, oh, yeah, I do all this alternative stuff, all this integrative stuff, and they have no clue what they're talking about. It's the same mindset. It's like the whole supplement industry, right? It's the same mindset as the pharmaceutical industry. Oh, you've got high blood pressure. Oh, you need these 3 supplements. That's the same, mindset as
most of the supplement industry doesn't go after that. They go after fat loss.
Yeah, that's true. Yeah.
Hey, you don't even need to work out. Right. Just take these pills.
Take all this, green tea, and you'll be great.
If they're lucky, green tea, that actually makes some sense.
Yeah.
That actually might be helpful. Yeah. But most of the time, it's some kind of fucking super high caffeine, this fat burning, whatever, Xenadrin, whatever, and that's causing another, basically just stressing your system out to burn as much as it can, make you not hungry. You're probably craving sugar and you're just literally dried out. I mean, you see people on these high dose stimulants, whether they're fat burners or high dose Adderalls or, whatever high dose stimulant they are. And they're all right, maybe you're losing a little weight, but at what cost?
Yeah. I remember a patient, this was several years ago. She said, I need to come see him, having a lot of headaches, really bad headaches for the past month. Came in. She said, well, what's going on? Her blood pressure was 180 over 120, which is, fairly high, certainly for her. Well, what have you changed? Well, I was watching Dr. Oz and he recommended these raspberry ketones and, the raspberry ketones, that's basically like ephedrine. Good. So you've jacked your blood pressure up to the point you're having crushing headaches. Yeah. How is that good for you? So to answer your question, where do you find a doctor? It's very challenging. And honestly, it's probably not going to be, again, doctors are not going to be leading the charge here for the most part. They're just not. I mean, it's people like you and other people who are willing to talk about these broader issues that our society needs to listen to.
What do you recommend for people? Because I think a lot of us have parents or friends who are just so locked in the fear model. Yeah. The fear has hooked them deep, and so even talking to them about doing something that their doctor isn't telling them what to do, it's a very difficult conversation. Like, what do you recommend for people who are kind of locked or want to help somebody? Let's say they're on board.
I mean, what I've learned over the years, you have to meet people where they are, right? Like, you cannot convince anyone of anything. Like, we're all our own experts, right? And so it becomes a battle if I'm sitting across from a patient trying to convince them, oh, you need to be in ketosis, and they're like, I don't agree with you. Okay. Google says this. Okay. I can't even have that conversation. So I think you have to meet people where they are, and it's finding small little things that people are probably already doing. Like, most people are taking a multivitamin. Most people are taking some sort of supplement that okay, you understand that your health is not just based on the 6 pills you take from your doctor, right?
Mm-hmm.
Okay, so you get that. So let's then take that a step further. You understand that, oh, if you walk around the block after dinner, you feel better.
Yeah.
It's little things. But the generation of our parents, grandparents, very challenging. It's ingrained.
Once it's entrenched that deep. I've always recognized that fear is the one true virus, and it spreads, and it's so contagious. And
it's so powerful.
And once you're deeply infected with that fear virus, it is difficult. You really have to cure that virus first to cure all the rest of your other viruses.
Yeah, like I had a patient, this was years ago, and was giving her bioidentical progesterone, and every time she came in to see me, she said, "Oh, is this going to cause breast cancer? I'm afraid that the progesterone is going to cause breast." It's not, but I don't want you to think that way. A couple of years later, her husband comes in, she's got breast cancer.
Mm-hmm.
It's very powerful. Yeah. And I'm not saying that people cause their cancer, but they certainly contribute.
Sure.
I mean, and I think that people need to be willing to take responsibility for their health and say, it's not just, your genes or what your diet. A lot of it's your thoughts. It's that narrative that you run.
Well, your thoughts through epigenetic, switching, your thoughts will change your genes. It'll change your genetic expression. That's why all that 23andMe and all the fear and shit that came out from this genetic, they're not even actually allowed to talk about these genetic predispositions anymore, because it's not really there. Like if you tell somebody that they're going to get something, and that has a real effect.
Huge effect. There was a study, I'm going to get the details wrong, which I like to quote people. They did, it was a nutritional study. They gave a group of Swedish women traditional Swedish food, a group of Thai women traditional Thai food. Same caloric content, same nutritional content. After they ate, they drew blood and measured different nutritional markers. Second part of the study, they switched it. Swedish women ate Thai food, Thai women ate Swedish food. Same thing, drew their blood. Third part of the study, they took that Swedish food and they pureed it. So it didn't even look like the food, but it was the same exact food. Same thing with the Thai women. All 3 phases of the study had different nutritional values, even though it was the exact same nutritional content. The highest was when the Swedish women ate the traditional Swedish food and the Thai women ate the traditional Thai food. Conclusion is, what you think about your food, your thoughts, literally change what it does for you.
Mm.
That's super powerful.
I have a practice in my book, once again, and I borrowed it from Aldous Huxley's book, Island. Did you ever get a chance to read that book?
Not yet.
It's great. It's this utopian vision of what society could look like holistically, from medical to social to relational to all the different ways that you could build a utopic society. And one of the practices they have involves, their way of saying grace. And I've kind of modified that as well to, instead of saying grace in some kind of very religious context, like take a moment to create the perfect bite of food. Your very first bite, make it as good a bite as possible. So if you got the steak and potatoes and the little spinach and all the savory, all the flavor, all right, make yourself a really good bite. And then think about all the food and where it came from. Think about the cow that was grazing on the ground. Hopefully it's grass-fed steak. So the cow that was grazing on the grass and the sun that was hitting the cow, and the way that was processing the nutrients from the earth, and how the grass was drawing up the minerals from the soil and soaking in the sun, and the water that was going in, and that fed the meat, and then the potatoes, where they were from, collecting all the dense minerals and starches from and all of this. And then, take a moment to mindfully eat that, enjoy it, appreciate it, chew it, and also remind yourself that this is nourishment. Like remind yourself that this is fueling your body, just as those things that you had were fueled from the soil and fueled from the sun and fueled from the water, and create that loop as a protection, so that you're both mindful of what you're eating, for one, and then also triggering that, all right, here I go. Here I am nourishing myself.
And it's empowering, right? Like, because you're in charge of that process. And I think so many people, because of fear, feel so disempowered when it comes to their health. They have no control.
Well, we've been told that we're faulty machines, and that we're faulty machines, and that we're broken, and that we're broken, but don't worry, there's a solution. Not that, no, actually you're whole, you're well, you're healthy. You have the blueprint of being a perfectly functioning, energetic, love-filled sex machine. You are that.
All of us are.
All of us are.
Yeah.
And we just have to find the ways to get back to who we truly are. It's not that we're broken and we need to fix ourselves.
No.
We're fixed. We just need to support ourselves so that can actually express itself.
Yeah. And so that's why I think all of these different interventional modalities, whether it be supplements, IVs, fitness, they're just bridges to get us to the place where we actually can believe that again.
Mm-hmm.
Because then we actually feel it. You know, like you work out and you actually feel really good. You're empowered now that, you know, I was strong. I actually accomplished something today. That's empowering.
Yeah.
Or you eat a healthy food, however you want to define it, that's empowering to people. Or you take supplements and you feel something. They're just bridges.
Yep. Now, one area that, you know, due to a lifelong, you know, habits of living in suboptimal ways, I think fighting the hormone battle is something that I think makes a lot of sense for a lot of people to take a look at supporting.
Sure.
You know, and there are plenty of natural ways to help support your hormone balance. And I think you try those first.
Sure.
But as far as supporting the body with hormones, I know that's something you get involved with.
Sure.
You know, how helpful is that to people in general? I mean, is that one of the main areas you look at?
Yeah, I think that the hormonal system is the most influential aspect of human health. And so, you know, if you take the easiest example is testosterone in men, right? Testosterone gets a bad rap because people say, oh, it's for meatheads and bodybuilders and this. But testosterone is critical to a man feeling like a man. You don't have that, or your level is low, you don't feel like a man. Well, now you bring in fear, you bring in self-doubt, you bring in self-worth issues.
Mm-hmm.
Of course, you're going to go about your day feeling worse than you can. Biochemically, though, for testosterone, for men, low testosterone, number one risk factor for heart disease, stroke, dementia, depression, 4 big bad diagnoses. Low testosterone leads to poor sleep, poor memory, poor energy. I mean, it's very real. The trouble with hormones that I see is that people like to isolate them, and they say, oh, you know, just take testosterone. You don't look at the big picture because there's nothing is an island, right? So testosterone influences estrogen metabolism and cortisol metabolism and thyroid metabolism, and having a sense of that whole kind of, I think of it like kids on a playground, right? Different personalities, but it's how they interact. There's some bullies like cortisol. Cortisol is a bully. Insulin, that's a bully on the playground. Testosterone's a happy kid, having fun, right? People like to be around testosterone. It's those interactions.
Well, sometimes a little too much testosterone.
Too loud testosterone.
Yeah.
The kid is being too loud is obnoxious. Yeah.
Right.
But those interactions what define us. And then, you know, we can test and monitor these things, but it's not just about the numbers. I have a patient, he's in his 80s, ex-Secret Service, Marine, been on testosterone for a long time, and he is so focused on the number. He wants to get his blood checked every 6 weeks. Whether his testosterone's 1,000 or 200 doesn't matter. He tells me he doesn't feel good. It's like, what are you doing then? Why are you even measuring these levels? And I think for these hormones, there's a sweet spot, and it's finding how people feel and relating that to their numbers. Because, you know, there's a good book by Robert Sapolsky, a sociologist from Stanford, wrote The Trouble with Testosterone. Right. He also wrote Why Zebras Don't Get Ulcers. That's a more famous book. Trouble with testosterone is that, you know, I'm going to mess up the details, but he studied baboons. There's the alpha male has the highest level of testosterone. Then there's the number 5 in the pecking order. He has the lowest. Well, those two, number 1 to number 5, have the shortest lifespan. Why? Because of the stress involved with trying to maintain the highest level of testosterone at number 1, and at number 5 trying to get to number 1. Very best place is number 3, right in the middle.
And it's another one of those psychosomatic connections as well, because they've looked at studies too where your posture will actually affect testosterone levels. Like you measure like a really hunched over submissive posture, and you check testosterone versus this put your arms out like you're fucking Conan the Barbarian, and you're just slathered in bitches. And you go out and you look like that, and your testosterone's actually going to be measured higher at that point.
Yeah. And they've shown testosterone's a biosocial hormone. So if you're around people with higher testosterone, it will actually raise your testosterone.
Man, I knew I liked hanging with Tim Kennedy. I knew that was a good reason for that.
That's funny.
Yeah, that's
So hormones are really important, super important. I think that the trouble with hormones is, number one, we get into that cancer conversation where people are afraid, oh, hormones cause cancer. That's not true. Cancer is not caused by a linear equation, right? Too much estrogen causes cancer. That's not true. There are actually studies using estrogen to treat breast cancer. Same thing with testosterone. People say, oh, testosterone causes prostate cancer. Bullshit. Who gets prostate cancer? Men, when they're farthest away from their testosterone levels being high. So it's not linear.
There may be some correlation between exacerbating existing tumors. You know, like assisting. Isn't there some studies on like if you have an existing tumor and then you take a bunch of growth hormone or something like that.
Growth hormone's different.
Growth hormone's different. Yeah.
So
maybe it's not even testosterone. But
well, testosterone, I think the issue with testosterone is testosterone converts into estrogen. As men get older, we make more estrogen and less testosterone. For the prostate, our prostate seems to be more sensitive to that estrogen than testosterone. Well, doctors don't know how to manage testosterone, so they're prescribing testosterone but not measuring estrogen levels. I saw a patient years ago. He was given, this other doctor was giving him a topical cream of testosterone at 500 milligrams a day. That is a buttload of testosterone every day, 500 milligrams.
Notice another medical term. Yeah. 500 milligrams, that is a buttload.
Yes. Thanks for clarifying that.
Different than a fuckload, which was...
But his estrogen level was higher than many women. And he came in, he's like, I'm crying, I'm emotional. Well,
my nipples are sore.
Yeah, it's because your estrogen level, but the doctor didn't know how to manage it.
Right.
And so he just gave him tons of testosterone because, testosterone's supposed to be good for people. So it's really about doing it in a safe way. And then you have these people who are 18, 19, 20 who are saying, I'm going to use testosterone growth hormone and get super big and super strong. Well, then they burn out their receptors. And so now when they're 35, they need a ton of testosterone just to make up for it. Well, a ton of testosterone means a ton of estrogen.
Yeah.
So there's always downstream effects. Yeah.
And that's really the idea is don't look at these things in isolation.
Exactly.
And that's another big problem with the medical model, like looking at things in isolation.
Oh, it's all in
even
isolation.
like the blood pressure medication is another one that just boggles my mind, because you're treating something as an isolated symptom. Yes, people with heart disease have high blood pressure, but the high blood pressure is generally caused by arterial plaques and other issues like that.
Right.
The blood pressure itself is not the problem. So you get these weird diagnoses where you get people prescribed statins and people told to stay away from salt even before they have heart disease because of the correlation between blood pressure and heart disease. But it's actually not the blood pressure that's fucking causing the heart disease at all in the first place.
Right.
It's a totally different system. It's the high sugar diets that are causing the fat buildup in the liver and causing the fat buildup in the arteries. Yeah. Those very dense LDL particles that are getting jammed up in your arteries that's actually causing the heart disease. It's not the fucking sea salt, man.
It's not. And then what I like to think about is where do we make most of our hormones? It starts with cholesterol. So when we look at people in their 40s and 50s and they have elevated cholesterol, why is that? Well, it's because their hormones are low. And so it's the body's response to making more cholesterol to make up for a low testosterone. And so if you then we now have a generation of people who we put on statin drugs and we've knocked out their cholesterol, well, of course they're going to feel like shit because they have no hormones circulating. Yep. And that then is more stressful.
And then, a ton of research I put in the book too on eating cholesterol.
Yeah.
Eating cholesterol actually helps your cholesterol ratio.
Yes.
Like dietary cholesterol is a fucking superfood.
Right.
And it's so annoying to me because I'll still go to like a nice hotel and you'll look at the healthy menu and it's all fucking egg whites. Fuck your egg whites. Fuck your egg whites. You're taking the superfood out of the fucking egg.
Right. Well, it's like people say, don't eat egg yolk because it has just bad cholesterol. Bullshit. Nothing has just bad of anything.
There is no such thing as bad dietary cholesterol. It's just cholesterol.
Right. I know.
It is just cholesterol. Yeah. And that's the thing that people are getting wrong. Dietary cholesterol does not correlate to VLDL cholesterol. In fact, it actually transfers your low LDL cholesterol, the cholesterol that is bad, the small boats that carry the cholesterol into the cell. It actually, by eating more cholesterol, it turns it into the positive parts of the cholesterol that actually nourishes the system, that nourishes the hormone system.
Yeah, no, it's true. And then they've done studies, too low cholesterol is early death, causes
all kinds of problems.
Shit. All kinds of problems. And that whole thing with the statins is totally manipulated by the pharmaceutical. That's a great example of science gone wrong and saying, there's one group of people who have benefited from a statin drug, people who've had a prior heart attack. Lowering their cholesterol does help prevent a second heart attack. And what they've done, they said, if it helps prevent a second one, it must help prevent a first one, which has been bullshit. Again, the number one risk factor for a man for a heart attack is low testosterone.
It's the same thing with salt, right? Like the saying that salt is bad for the heart, which is what everyone's put out there, is just false. Yes, if you're fucking hanging on by a thread, and you really need your blood thin as shit, because sodium is going to help your body hydrate. It's going to help your cells store more water.
Absolutely.
So it's going to increase. It's going to make your blood thick.
Absolutely.
It's going to increase your blood pressure. Okay, got it. If you need to fucking thin that thing out because you're barely hanging on, I get it.
Right.
Low sodium, that makes sense.
Right.
But if you're a healthy motherfucker, you need those electrolytes. You need those nutrients in your body. And that's where this weird correlation game has just
all
gone
correlation.
askew.
It's all correlation.
Yeah. And we're starting to unravel that. It's just taking so much time, which is crazy with the availability of information. But the problem is information splashes against the wall of fear.
Yep.
And then you don't even accept the information because your fear is primary.
Right. Well, and that's why I wonder, not to be a conspiracy theorist, will the pharmaceutical industry let MDMA come out in 2021?
They can't stop the process.
But it's a good question.
Because they live and die by that same preclinical safety leads to phase 1 pilot, leads to phase 2 general efficacy, leads to phase 3, proof, phase 3 proof. Mm-hmm. Once we're in the medical system, you would have to basically tear down the model by which they make their livelihood in order to attack the efficacy of the drug. And I think they're just going to have to adapt. They probably, some of them are probably a little stressed, but then they also realize, there's fucking plenty of people who are still going to be afraid. Plenty of people the market, they're going to be all right. They're going to eat.
You're right. I mean,
Pfizer's going to eat.
Oh, Pfizer's going to eat. Pfizer will have 6 other drugs.
And guess what? Just keep making stuff like Viagra. Good job.
Exactly.
Good job.
Right. Lifestyle medication.
Yeah, for sure. Fucking cure more STDs.
Right.
Like go for it. Go wild.
Right.
Like there's useful drugs.
There's definitely
Thank
useful
you
drugs.
for the useful drugs.
Right.
Just focus on those, please.
Right.
But the entity, the problem with these pharmaceutical, and even I worked in pharma for a little while. I was working with a company out of Edmonton that was making potential therapeutic, like immunotherapies for ovarian cancer.
Okay.
And they made it through phase 2 and they had some interesting data, and then they were going through phase 3. It ended up not panning out in the phase 3 trials, but they were really good meaning individuals just trying to put forward a good drug. But the problem is when it gets to the really big guys, then it becomes an entity, and that entity has its own desires to feed. It has a lot of people with salaries. Sure. It has a lot of employees. It has stock. It has pressure from the investors. It has a stock price. It has, and what it needs to feed is profits. It needs to feed itself through profits. And so you have to look at these like animals that are trying to support all of their extremities and limbs. And they don't want to cut off an arm to survive. They want to continue to grow. They want to continue to expand. So they're just going to try and feed it with more profit. So you have to look at these not as like a bunch of evil people, but as an entity, like a collective that has decided that it's just going to grow at all cost, and it's just going to feed itself with more and more profits.
Right. Yeah. I mean, people say, "Oh, doctors are evil or pharmaceutical companies are evil." I don't buy into that at all. They're just doing their job. I mean, they're doing what they know.
Yeah.
And they just have a different mindset. We don't have to support it, but they're on a
and
different path.
And the people will lead. When the people, and I think it's the same with politics as well. Like we can focus all of our efforts on the organizations, and say like they should know better. They should do it. No, bullshit. The people need to lead. And if people stop showing up and saying, if people are like, no, I'm not going to do that. I'm going to try something else. Then the companies will adapt. The entities will adapt. The politicians will adapt.
Sure.
Like we have to be the movement. We have to be in the forefront and let everything else react accordingly.
Yeah, that makes me think of vaccines. So, this whole vaccine issue, like I think I'm the only doctor in Charleston, South Carolina who will write a medical exemption for parents who want to either delay or, keep those vaccines at bay for a while.
You must get a lot of shit for that.
I don't. And here's why. Because I take seriously the conversation I have with a patient is protected health information, and it is privileged, and no one has access to that but me and the patient, right? And so I don't care what the school says or what the health department says about we need to know why. No, you don't. And I take it to the nth degree. What if that child has cancer or AIDS, right? And now as a school that child, you're going to treat that child differently, and that is absolutely wrong, and that it can't be like that. And I think that's sacred, that conversation between the doctor and the patient. But when you have a government that's enforcing vaccines, injections into children without any conversation saying, oh, just trust us, that's a very slippery slope. Yeah. Very dangerous.
So this is a conversation that always gets people fucking riled up. And I think because there's so much fear and so much.
It's fear-based.
What do you recommend to parents who are just like, what the hell should I do? Because there's so much strong opinion on either side.
It's very polarizing. So here's how I look at it. I think if you look at vaccines as a whole, the majority of them are safe and effective. If you look worldwide at reducing communicable disease, they work. But there's probably anywhere from 2 to 5% of children who will have an adverse reaction to that a particular vaccine. I know that the biggest wave that people talk about with vaccines is the thimerosal or mercury in these vaccines, which are leading to autism or other problems. I don't think it's that. Like, there's more mercury from jet fuel that falls down on us every single day than that being a vaccine.
Mm-hmm.
I think the issue is the vaccines that are grown on human tissue, varicella and MMR. If you were to get a kidney transplant, right, we'd have to wipe out your immune system for you to accept that kidney. If you give a vaccine to a child that's grown on human tissue, we do nothing to that child's immune system. So of course, statistically, there's going to be some, incompatibilities. That's not a big deal. And why is it wrong for a parent to question that and want to delay? The longer we delay, the more mature that immune system is. So I go down all the vaccines. Hepatitis B, I think it's really important because hepatitis B leads to liver cancer, right? But does a child when they're born need hepatitis B vaccine? No, it's a bloodborne disease. Wait till they're a teenager. Why do we have to rush it? Tetanus. We haven't seen tetanus in 100 years. Diphtheria, same thing. Pertussis is treatable. Like, we can hold off on these ones. I think the most important one is polio, even though it's super rare. It's because if your child gets polio, it's devastating.
Yeah.
Right? The vaccine seems safe. Do a polio shot.
Yeah.
And I tell parents I would delay or seriously consider not even doing the live vaccines. Varicella, chickenpox is not a big deal. And MMR, we don't need it. And then the critics will say, well, we're going to have pockets every couple of years of kids getting measles and mumps. And we do, but guess who also gets measles and mumps? Kids who are vaccinated. So it's not this, straightforward approach. So what I tell parents is, number one, the most important is that both parents are on the same page, because this causes marital distress. And I've seen it so many times in my office where one parent is anti-vaccine, the other parent is pro-vaccine. And that's just discord they don't need to have. So get on the same page, even if it means you wait. Like, what are you worried about? Why are we rushing this stuff and saying it has to be at 2 months, 4 months, 6 months, 9 months? Like,
it seems like an unnecessary stress on an already stressful time.
It's very stressful. And what I don't like about it is you have, both opposite ends of the spectrum. You have the anti-vaccine people who say all vaccines are bad. That's absolutely false. And then you have the public health people say all vaccines are amazing. Well, that's false too. Why can't we have a discussion? I mean, I don't understand. Like, I had a patient, like, this sounds crazy, but this just happened a year ago. The parents called me and they said, okay, our child's due for the DTaP vaccine, diphtheria, tetanus, pertussis. And they said, we want to do one that's a different brand. We asked the doctor, we'll get the vaccine, but can you do a different brand? No. Okay, can we buy a case and bring it to you? You'll still document you're giving our child. No. In fact, we won't do it and you need to leave our practice. Like, it's such a polarizing, discussion. I don't even understand it. So I tell parents, take your time. Like, don't rush. It's not a big deal. If you're traveling to some third world country, sure. But who's bringing a 6-month-old to there anyway? Right.
Yeah.
So.
Right. Yeah. It's interesting how some discussions, even having these discussions, are just freak people out, and how people get so binary with their thinking.
It's that fear. And I tell people the vaccine, the whole idea of vaccination is the herd theory, right? You vaccinate the herd, it protects everyone, right? Or mostly everyone. And what the parents who vaccinate, I don't understand then why they're upset if Johnny over there doesn't have his vaccine. Your child's protected. Why do you care what happens with Johnny, right? If you really believed your vaccine worked, it wouldn't matter what happened to Johnny, because it's that fear. And they can't help themselves.
Yep, that's the virus. Once it gets you, it affects your thinking, it infects your body, it infects all aspects of your being.
But it gets all of us. I mean, it's the journey we all have to go through, individually, to figure out how to keep it at bay.
Die to your fear and learn to find that thing.
Surrender.
Find that thing called love.
That's right.
Yeah, and you find that, and then you have a real guide star.
Absolutely.
Yeah.
Just like we're talking about, like, death is the beginning, right? So.
Yeah. So, Indeed, my brother. So what else, as we wrap up here, you know, what are some of the other things that you think people are just fucking sleeping on? Like if the people need to take a good hard look at that they might not be aware of. We talked about hormones. We talked about vitamin A, vitamin D, the free doctors that are available. Yeah. Like, what are some other things that can really help somebody that people are sleeping on?
I mean, number one for people to pay attention, we touched on it, is the mitochondria. I mean, this is the plethora of research in terms of all the big bag diagnoses, as well as performance and health. Pay attention to mitochondria, pay attention to NAD, because it's just going to explode in the next year and a half in terms of what we understand it can do. Again, I think a lot of the focus now is ketogenic diet, intermittent fasting, time restricted feeding, working on that mitochondria. I will say this though, that all of these things, they talk about promoting longevity. A lot of those studies are done though in species of animals who live short lifespans, like a mouse, right? So if you put them on a intermittent fasting, you can increase that lifespan by like 40%. For humans, we're a couple years. So I think for people to start thinking about, to put this in perspective, because this is the trend, right? Ketogenic diet, intermittent fasting, how we're going to change our diet to increase lifespan. We also have to take into account quality of life. I don't want to just live longer.
No, I want to live better now.
Right. And so I think a lot of these therapies seek to just extend life, but at what price? And I think people need to keep that in context, because it's becoming very popular. I mean, I'm asked all the time about ketosis.
Well, it's this rampant fear of death too. You want to like live forever. If someone wants to make me a deal, another 36 healthy years where I'm fucking got energy and hormones and I feel great and I'm bouncing out at 72 to the other side. Okay, cool. Yeah. Where do I fucking sign?
Right.
I'll sign that motherfucker right now. Right. I don't need to live forever.
No.
The other side is beautiful.
Absolutely.
I can't speak forever. I can't give you proof, but I feel like I've seen that thing.
Sure.
I feel like I've crossed over that bridge and gone over the threshold, and it's fucking peaceful. And it's full of love.
And it's the most peaceful.
It's the most peaceful.
Right.
And okay, cool. So now how about let's fucking love our life. Let's love each other.
Right.
Let's help each other. Let's enjoy this experience, not just be skidding, towards a terminal end that we're terrified of the whole way, grasping to every piece of life so that we're not actually even living at all. That's no way to do it.
No way at all. I think something else people can pay attention to, which I value a lot, is cortisol and stress. I think the stress that we endure from a young age until, we can handle it. We can handle not sleeping. We can handle eating poorly, going out drinking, destroying our bodies, only to a certain point, right? And then it catches up with us. And the problem isn't so much that, you feel bad when you wake up from a hangover. It's if you deplete your cortisol reserve over time, well, what happens then when a loved one dies or you lose your job? A real stress happens, right? That's when people break, and that's when bad things happen.
Right.
And so protecting that and preserving that through mindfulness practices. And
because the thing is, like, most of us, as soon as we feel decent, it's
We
fucking
screw it.
party time.
Right.
Woo! I
Right.
feel decent.
Right.
Let's go crush the body.
Right.
Because now I got the energy to fucking destroy myself.
Yeah.
And I've been in that pattern, and
Yeah.
I think most
We
of
all
us
have.
have,
We all
rather
have.
than taking the opportunity to really build in the times of plenty, in the times of abundance, and when things are good. Like, rest extra, like sleep more, love better, like take vacations, not when you absolutely fucking bleeding need it, but maybe like to support yourself when you're well, so you can build up those energetic reserves, so that because the universe is going to dial in some fucking curveballs. They're going to be
guaranteed.
They're going to be spitting on that base. There's going to be Vaseline and sandpaper and fucking screwballs and ephuses and all kinds of things for you to swing at and miss and get crushed by.
Yeah.
So
I like the way you said that. And that's what I tell patients. You're going to be thrown curveballs. That's a part of life. Expect it and prepare for that. Because if you prepare for that, you're going to be better served.
No doubt. Man, it's been one of my favorite podcasts ever.
Oh, awesome.
I appreciate
Thank you
that,
so
brother.
much.
Where can people find you?
They can find me if they go to koniverwellness.com.
That's with a K, everybody.
Koniver, Koniver Wellness.
Dope. Thanks for coming on. And
Thank
thanks
you,
for,
Aubrey.
I know we got the Fast Vitamin IV, one of your
Yes.
babies that's coming in for some IV vitamin therapy.
We're
and
excited about it.
glutathione. And you've been a huge help to my life personally. So just so much gratitude for you, for what you're doing for the world, what you're doing for me, and now what you're doing to the people here on the podcast.
Thank you, Aubrey. I really appreciate it.
Absolutely.
All right, man.
All right.